We have been preparing almost for 1.5 years, even prior to today's time. We have constituted various committees to take care of each section of the conferences which it requires. And having had the experience of the first ICC in Delhi, now we know what area to concentrate and what is the depth of involvement that's required from each committee. Any big conferences has two major challenges to face. The one is, how do we really accommodate such a huge gathering in terms of they staying here in Bangalore? Two, and even in the venue of the conference, how do we really distribute them and for the main course of the conference and the breakaway groups that we are going to have? Given the challenge to us, and we really went around the city and searched for venues and finalized some of the venues which can take up this challenge. So that was a big task for us, and now we are fairly confident, yes, and we can meet that too. One. Number two is always it's easy to say we had 5,000 in the last conference and we can have a 10,000 this time. It won't just happen like that. Anybody who attends will be looking for what do I really get in terms of scientific content that it has. That is where we have done most of our attention has gone into that. And in fact, tell you, and we are planning for 4 Nobel laureates to attend this conference.
One of the things that we have noticed over conferences over the years, for all specialities, as you very rightly said, what's the take-home message? Now here, we are planning to have clinics for, let us say, recurrent disease. We're planning to have master classes, how do I do it kind of stuff. So the younger generation will actually get a chance to interact with very senior faculty, learn from them practical things. Personalized medicine that we mentioned earlier. If you have a recurrent disease, how do you handle it? What is it that the geneticist can contribute? What is it that the pathologist can contribute, or imaging, and so on and so forth? So they will actually get practical lessons of how to deal with patients when they come into your clinic. There's a communication workshop conducted by psycho-oncology. How do they benefit from that? How do they communicate? There is going to be a clinic to talk about the morbidities that treatment creates. Now, no treatment, as you know, is without morbidity, but we very seldom talk about it. Now, we want to know in this conference, what is the actual morbidity that is seen? How do you tackle it? And therefore, what is it that the patient will benefit? The youngsters today have all the knowledge that the internet can give you. But as you very rightly said, how do you translate that into better patient care? And I think we are putting in a lot of effort to see that there is a take-home message available in this conference.
We are inviting quite a lot of the foreign, the health, the administrator to our country and into participate in this program along with our health administrator and policymaker, and what kind of a white paper that we can bring it out, and which will be actually a roadmap and down the line in 10 years later how our cancer scenario can be changed, particularly with reference to catering to the needs of the patient, and be it in their town or in the city or in 3 tiers towns too. And that's our major attention in this conference.